Hi, I'm Nick Nanton, and welcome to Times Square Today. And today I've got a great guest for you, Dr. Fred Abeles. Dr. Fred, welcome to the show.
Hey Nick, great to be here.
It's awesome to have you in this beautiful setting. Great day, thankfully.
Very cool.
We've been here on many rainy days before. This is a great day, so I'm excited. So you've got a pretty storied career. You are the medical director at the Las Vegas Institute for Advanced Dental Studies. You're a jazz pianist who's performed for 3 different presidents.
Yep.
You have a private practice in Atlanta, and you've literally spoken all around the country to thousands of people. So I'm excited to have you on the show. So
it's great to be here, man.
The question is, obviously, I know you a little bit, but our viewers don't. I've obviously hit some of the high points, but what should our viewers know about you?
Yeah. I guess other than what you've covered, I've got a private professional practice in Atlanta. It's called the Atlanta Center for TMJ, and I'm also the clinical director, as you mentioned, at the Las Vegas Institute for Advanced Dental Studies. Between that, it keeps me pretty busy.
Yeah, that is enough to keep you busy. Now, I know you have an Amazon bestseller, by the way. Congrats on that.
Thank you, man.
I happen to have a copy of it right here, Breakaway. So tell us a little bit about Breakaway.
Very cool. Breakaway is a book that I wound up writing because I had so many patients coming into the practice that were still miserable, they were still in pain, they were having all these headaches, all these migraines and TMJ problems. They'd been to a lot of other health professionals, but nobody really had been able to help them. So I wanted to write a book that would help the layman. Sometimes, Nick, within 3 minutes of a patient sitting down in my practice, they burst into tears. Clearly their lives were not working for them the way they wanted to. And I wanted to do something to write in simple, easy to understand terms for the layman that they could understand the cause, the effect, and the solutions to chronic pain. Kind of an interesting side note, after I wrote the book, I really just wrote it for patients, but it turned out that LVI, the Las Vegas Institute, where I teach, liked the book so much, they're giving it to every new dentist when they enter the Institute right now because they feel it's just a really simple, concise explanation of chronic pain.
I love it. Very good. Well, congrats on that. And so tell me
Thanks.
about the state of your industry right now. I mean, it's in, obviously a lot of industries are in flux with technology and everything else, so tell me about it.
You want the good news or the bad news
Give
first?
me both.
All right, I'll give you the good news first. The profession's doing great. The bad news is that 99% of the focus in our profession is on other things. It's on implants, it's on cosmetic dentistry, it's on Invisalign and orthodontics and braces. So the average dentist doesn't want to spend any part of their day really thinking about and treating patients with chronic pain from migraines, headaches, and TMJ. A typical scenario, a patient might go to the average dentist, and I'm not speaking adversely of my profession, I have the greatest respect for all my colleagues, but they go to a dentist, they're going to wind up making them a night guard and giving them some muscle relaxants, and they hope for the best. And it usually doesn't work out real well. On the other side of that, on the flip side, we've got the medical profession, and they've done some amazing things. We look at cardiac care or dermatology or ophthalmology or emergency medicine, all these sorts of things, or cancer treatment. We are literally world class in terms of our treatment. But when it comes to the treatment of chronic pain, in my opinion, we fall far short. Our system, unfortunately, is optimized. The insurance system and the medical care system, when it comes to chronic pain, is really optimized for quick fix. So the average patient is going to walk out of a doctor's office, they're probably going to have a few prescriptions in their hand, which is only treating symptoms. Then if those don't work, they go back to the doctor. Doctor says, here's some more pills, try these, see how that works. But they're not getting to the underlying cause. And here's the bottom line. If we don't identify the underlying cause of the pain, if we don't identify the tissue that's causing that pain's going to continue. It's just that simple.
It's just a Band-Aid. Yeah, we have all these things that we put on top of the problem, but we never get to the root cause of the problem,
Exactly.
so you're never going to solve it.
Exactly.
Love it. Now, your success has been amazing to watch, but I have a question for you. How do you stay so far ahead of the competition?
Well, I'll tell you what, I really don't view my colleagues as my competition, but if you ask what really keeps us out in front, I'd probably say 2 things, and that would be knowledge and it would be innovation. So knowledge, I'm kind of lucky. I'm on the faculty, as I said, probably one of the world's leading think tanks when it comes to chronic pain. So we have access to some information and knowledge that the average person does not. It really makes it easy. In some ways, I'm kind of standing on the shoulders of brighter minds that have come before me, Nick, that have done all the research and development. What we've learned after treating thousands of patients is that the alignment of our jaw and our bite relationship plays a huge role in causing these headaches, these migraines, and this chronic pain of the head and neck and TMJ pain. So for example, if someone's jaw is aligned too far up or too far back, it's torqued a little bit to the left or torqued to the right or tipped down to the left or right, somewhere other than where it's supposed to be, the muscles that have to support and stabilize that jaw, that's what fatigues, that's what wears out, gets stressed, or goes into spasm, and it creates the pain. 90% of pain comes from muscle. So the good news is, if we can focus on muscles and get them happy and get them working better, we can reduce or eliminate these symptoms. The second part of that question, I guess, would be innovation. And our world has now gotten kind of high tech. About 75% of what we do is all computer based. We track the jaw in 3D to 1/10 of a millimeter of accuracy on a computer. At the same time, we have EMG leads that we place on the muscles of the head and neck, so we're seeing how the muscles are functioning and behaving. If we put those two data points together, how the muscles are working best and when they're most relaxed, and specifically where that is, we really have something to work with. So our results have been absolutely amazing. It's very effective.
I love that. Now, when I get with guys like you who've obviously gotten to the pinnacle of success, you're at the top of your career, top of your profession, I like to ask this question. If you could tell the startup version of yourself one thing, what would that be?
Could I tell my startup self when I go back to buy some shares of Starbucks? Would that be cool?
That's fine.
That's not what you
Or
were
Apple?
shooting. That was not what you were shooting for here. I would probably say, if I had to tell myself something as a startup, it would really be, you can't be everything to everybody. Pick your niche, specialize, relentlessly pursue your education till you show up in the room and you're the smartest guy standing in the room in your field. If you look at the most successful organizations, in my opinion, in the United States, they focus on doing fewer things and doing better than they've ever been done before.
Very good, Dr. Fred. Well, thanks for sharing all that. Now, any last pieces of advice for people who are suffering from chronic headaches or migraines or TMJ?
Sure, stop taking pills to mask symptoms. It just flat out doesn't work. Find the right doctors that are out there that understand some of these newer principles and methods of treating chronic pain without medication. The right docs are out there, the right treatment's out there. They just need to find it.
That's great advice. That's Dr. Fred Abeles here on Times Square today. Stay in your seat. We'll be right back.